All right. Hello, everyone. This is Sayeeda Tayyeba Rehan, and I'm a 2024 graduate from Dow Medical College. And today we are recording our episode number 6 for Neurology Road to Residency podcast. And we have Dr. Robeson with us from Albany Medical School from New York. Dr. Robeson, can you please introduce yourself briefly before we start the episode?
Sure. I'm Kim Robeson. I'm the program director of the Neurology Residency at Albany Med in Albany, New York, which is in upstate New York. I am a neuromuscular physician. I've been here in Albany for about 4 years, but I've been in medical education for more than 10 years. So I've got lots of experience as a program director and assistant program director, and I'm excited to talk to you guys.
Thank you so much for joining us today. And we also have Ahmed with us. He's part of our networking team. Ahmed, can you please introduce yourself?
Hi, so I'm Mohammed Ahmed, currently a fourth-year medical student at Dow Medical College, and I'm part of the networking department. As Sayeda mentioned, I'm the team lead for the networking, and it's a real pleasure to have you with us today, Dr. Robeson, and we really look forward to an engaging and an interesting discussion that's going to be helpful for all the match applicants applying for this year. So yeah, really happy to have you.
Thanks.
All right, everyone. So we will move towards our question answer sessions. As we know that match application has already begun and the applications are about to close. So we will ask some of the mostly asked questions from student side and from students of Dow Medical College and students in general applying for neurology applications. So Dr. Robeson, my first question to you would be that what are some of the things that you notice in the applicant's CV that clicks you instantly and you say that, okay, this is the candidate I want to interview, or this is something really interesting. It could be anything on their CV or maybe their scores or any research or anything that you personally like or prefer for your program.
So we like people who are passionate about neurology. I also think it's important to recruit a diverse class with people who've done research, education, advocacy work, outreach. And so people who have spent time showing their dedication to neurology. I don't think there's one particular field that's more important than others, but I like to see people who've done more than just classes and board scores to show that they'll bring something different to the table.
Makes a lot of sense. Thank you so much for answering this question. So if I ask another question on the flip side, that those were some of the qualities that you just described are very important in a candidate, but there are some people who are mistakenly, unknowingly, unintentionally mentioning some of the things on their ERA CV or maybe their personal statement. So what are some of the things that you repeatedly witness and see in the applications that turns you off or that says that, okay, this is a red flag and these are the type of candidates I don't want to interview or I'm not interested in them?
So I think the biggest thing we come across is people who are not specific to neurology. We recognize that there are people who apply to backup fields. Neurology can sometimes be that. That's okay. But we want people who want to be neurologists. And there's nothing more frustrating than reading about why someone can't wait to be a radiologist or can't wait to just be a doctor, non-specific, right? I want to know what it is that brings you to neurology, why you're excited about it. And even if it's your second choice, there's a reason it's your second choice. And tell me what it is about my field that excites you.
All right. Yeah, that was a really important point. Thank you so much for highlighting that. All right. So we hear a lot about the scores, research, leadership, volunteer, and all the things and their importance on the ERA CV. So how do you personally balance all of those things while judging or evaluating a candidate for interview or while scoring? We are also hearing about some of the filters. So how true is the filter thing, and how do you personally manage this thing for your own program?
So we holistically review all applications. We don't filter out for any particular board scores. I think if you didn't do as well on a board as you would have liked, that's okay. Tell us why. So there's lots of opportunities now with the important considerations, and there's a place to actually put in there, what happened? Why did you not do well? What did you learn from it? And that's okay. We're really looking for people who have a depth of exposure, who not just have done 30 things, but haven't really participated in any of them. We want people who have shown that they're dedicated, who have invested in something that will make them passionate about the field.
All right, yeah, that makes a lot of sense. Thank you so much for this. So moving on towards the personal statement, which we often heard that it holds a lot of importance while judging a candidate. So, what are some of the things that you see in the personal statement that you like, or if you can advise the candidates how their personal statements should look like if they're applying for neurology?
So I think the purpose statement, I'm looking to know who you are, to know why you're interested in the field, to want to know what you plan to do after. You may not have decided, fellowship, subspecialty, but do you see yourself as a clinician? Do you see yourself as an educator or a researcher? I also think it's really important to not have grammatical errors, spelling mistakes, read it, have someone else read it. Those things are also really big turnoffs when we're reading through them. Make sure that it is accurate and that you don't have little mistakes that will turn people off.
Mm-hmm. All right. I am taking notes and everybody else would be taking the notes on this answer. So yeah, thank you so much for answering that in such detail. And let's move towards the interview session. So we know that once we make to the interview, it all depends on the interview. So what are some of the tips or tricks that you would like to advise the candidates? How should they behave during the interview? What should be their approach? What are some of the qualities that program directors notice instantly? What are some of the qualities that you personally like in a candidate during the interview session?
So be honest. I think the interview is a two-way street. Once we've interviewed, or once we've selected you to interview, you're interviewing us as much as we're interviewing you. And so I don't want you to say just the things you think I want to hear. Ask questions, show that you're interested in the program, and use that time, because that's your time to find a place where you're going to fit in. You don't want to go to a program where you're not going to fit in. So we can tell when you're just giving surface level answers, when you're saying what you think we want to hear. We want to get to know you. That's the point of the interview. So be open, be honest, ask your questions, and recognize that you're interviewing us as much as we're interviewing you.
Mm-hmm. All right. Thank you so much for giving your insight on this. Oh, yes. So we have this question that you already described it in detail, that people applying for multiple specialities and not keeping the difference in their personal statement and ERAS. But what are some of the other mistakes that you are noticing on the ERAS application, or maybe on the personal statements, that you would like to highlight here, that kind of, sometimes frustrate program directors? Okay, this is a very common mistake and you might like to highlight it here.
So we want to know about the things that made a difference. I don't need to know that you went to one meeting from one club 7 years ago. So things that are recent, things that are relevant are most important for us to read about, and why it's relevant, why it's important to you.
Yeah, that makes a lot of sense. So continuing that question, so you were just summarizing that. So you are saying that some of the experiences, if they are very old, like if someone did anything before their med school or in their high school, so that is not kind of important, making the CV crowded or taking a lot of space like that.
So I think if it's something that you were really involved in and spent years doing, sometimes we read about people who were on a sports team or played an instrument, and they find that to be really part of their identity, that I want to know, and that's fine. But unless it reaches that level, I would say if it's before medical school, I would not include it.
Mm-hmm. All right. That was a very important point, honestly. So yes. Okay. So I do have few questions about your program specifically, like the Albany Medical School. What are some of the unique features that candidates should know when they're applying for the program? What are the fellowship options they are getting, your residents? And what are some of the things that if someone is applying for and keeping Albany Medical School as their top priority, what they should know in advance?
So I think one of our real strengths is that we are the only game in town. And so if you look geographic wise, we have this huge catchment area from where we are in Albany, pretty much over to Rochester, up to Canada, down towards the city, over to Boston. Everything comes to Albany Med. And so you're really going to see a depth and breadth of exposure. We have subspecialty representation from all of the different subspecialists. We do have fellowship programs in stroke, epilepsy, neurophys, movement disorders, pain, and then a EFNS, Neurocritical Care Fellowship. But we have like 1 to 2 fellows each of those things. So we are really a resident-driven program. If you come here, you will graduate being able to go out and practice. Saying that, I would say most of our residents, probably 4 to 5, if not 6 every year, do go out and do fellowships. And we really have matched people at outstanding places across the country. We try and keep people. I think if you want to stay, we want to keep you. That shows that you are happy here and you like Albany. But we also have probably about 1 per year people who just go out and practice. And that really is our goal, that you will come out of our program being able to go out and practice, because we are a resident-driven program. So by the time you are a 4th year, you are leading the team, you are making the decisions, and you've seen enough to be able to do that.
That sounds a lot of diversity, and like you guys are getting a lot of new cases and rare cases as well, because of the only hospital in a huge region. So that sounds interesting, honestly. Okay, so yeah, few of my last questions would be, what would be your advice for anyone applying second time for this math cycle, like who applied last time and they were not selected or matched? So what would be your advice particularly for those candidates?
So again, be honest about it. We can tell when we're reading your application. Don't pretend like it didn't happen. Tell us what you learned about it. Tell us what you've done in the last year to make you a stronger applicant. I would say the thing with particularly international grads when we're reviewing applications is lack of US exposure or experience. We want you to have done something. There's lots of ways to get even just shadowing exposure. There's even virtual opportunities now since COVID has come out, and we take those things seriously. We want you to have some exposure to the US healthcare system before you've come. And so I think those things are important to do if you don't match this year in order to make you a stronger applicant for next year.
All right, yeah, these are very important points. Okay, so yeah, one of my questions would be regarding the signaling. So this is a new trend I know since last 3-4 years, and students want to know, applicants want to know that how does your program value signals? Is it like if they signal, they gonna get the interview? There are high chances. Do you guys like value the signaling?
So I think it's changing. We're also figuring it out as programs. So far, I have reviewed every application and used signals where if you're a borderline candidate, that would give you the edge. However, 100% of our match applicants last year signaled us. And so that's something we can't ignore. And so I think that we will be paying more attention to signals. I'm actually planning to go through the signaled applications first this year, and probably having a lower threshold to invite to those applicants, because I think it really does show interest and exposure. And so I do still plan to review all applications, and I will get through all of them, but I think that they'll be looked at much more heavily if you signal us.
Okay, that was a very important point that candidates will be noticing about the signaling. So yeah, my last thing would be, is there anything that you want to ask about our program, our medical school, Dow Medical College, or any questions that you have about our sign group, or anything that you want to advise specifically to the candidates applying from Pakistan or from Dow Medical College?
So I think it's great that you guys do this. We always get lots of applicants. It appears that lots of people do neurology, which is exciting. And that's probably due to exposure and these types of opportunities. So we appreciate that you're doing it. We want to get our name out just as much as you want to learn about the programs. We are definitely, we review all applications. We are IMG friendly. We are looking for people who are hardworking. Wherever they've come from, we think that diversity of exposure and training is important, and it adds to the wealth of experience that you get once you come here.
Perfect. Thank you so much, Dr. Robeson, for taking out time to do this. I'm going to end this podcast right now for all the candidates. So this was our episode 6, Road to Residency, and this is our last episode that we recorded for this whole series. Thank you so much, everyone, for tuning in. We will see you guys in the next season. Take care. Bye-bye.